the variant of COVID that first started in India is now about 10% of all of the cases in the U.S., and at some point it's going to become the majority. If you've been vaccinated, the vaccines are highly effective, and you don't really need to worry.
For the unvaccinated, health experts warn this Delta variant is already more contagious and more lethal. New study out of Scotland shows the variant doubles the risk of hospitalization. This is not good at a time when we're doing so well. But at least there's this. UK officials say 2 doses of the COVID vaccines have been highly effective against it, as you just heard Andy Slavitt say. Back again with us tonight, Dr. Vin Gupta, a critical care pulmonologist out in Seattle who specializes in these very illnesses. He's also on the faculty at the University of Washington Institute for Health Metrics and Evaluation. And Doc, again, it's sad and alarming because otherwise cities are opening. New York's about to have a ticker tape parade for its first responders 2 weeks from now. And yet all we're hearing about is this Delta variant. How much in the real world of the United States 2021 does it worry you?
Good evening, Brian. I think it worries us all in public health and those that are clinical, because what we're seeing in hospitals across the country, anecdotally, I saw this just 2 weeks ago, is that unvaccinated young people are requiring intensive care. And I think your team actually, if we can do some brief chest x-ray rounds, might actually have a chest image I want to show all your viewers there. There we go. That is the image of a 30-year-old patient I took care of a few weeks ago. That is something I just didn't see. My colleagues typically did not see 1 year prior. Anything that's white in the lungs, those lungs kind of like those pie-shaped figures in the middle of the image, lungs, air should look black on a chest x-ray. The areas that are white in areas that should otherwise look black, that's pus from COVID-19. That's what we're seeing amongst young people coming in unvaccinated. And unvaccinated people are peppering hospitals across the country. And so what I'll say just as clearly as possible, we need to make clear that those that are unvaccinated, that the threat level, the threat has changed. Maybe it's no longer calling it COVID-19. We call it COVID-21. I don't know. But remaining unvaccinated on June 14th of 2021 is fundamentally more dangerous than remaining unvaccinated 1 year prior.